So today we will start with the unit 5.11, working with multidisciplinary teams in health and social care, and we will be covering a part of learning outcome 2 that states understand how to build and lead multidisciplinary teams to achieve integrated service delivery for stakeholders. This is basically how the multidisciplinary teams of professionals, teams of experts, they are constructed, and how the teams are led to ensure quality of service and integrated service for stakeholders. So stakeholders here, they mean service users, they mean service providers, they mean different agencies that are responsible for the regulations and monitoring of the health and social care services. So when we use the word stakeholders here, so it means more than one category of people, but mostly here in this unit, stakeholders, they mean the service users and the people who are providing the service other than the agencies that set rules and regulations. So this, as normally is with the rest of the learning outcomes. So learning outcome 2 is divided into 3 parts. So 2.1 says evaluate the strengths and weaknesses of multidisciplinary teams for integrated service delivery. Here you are going to look at strengths and weaknesses of multidisciplinary teams. When we started our, when we were having our previous lesson, that time we stated few of the problems that these multidisciplinary. Hello? 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 Hi, Farah. Hello? Hello? Hi, Farah. Hello? Hello?
Hello?
Yeah, can you hear me?
Okay.
There is some disturbance at your end.
Is there? It went off.
Are you all right?
Yeah, everything's all right now.
Okay, because you just you went offline and you were mute, so I was just calling you. Anyhow, so
I tried to go on the learner management system on the new tab.
sorry.
I tried to go on the learner management system on the new tab.
Okay. I haven't uploaded things, but today, before the day ends, I will be uploading the previous stuff and today's stuff on learning management system and few other helpful guidelines and few other helpful articles that can help you writing your assignments. So I will be uploading as Moodle before the day ends today. So you can find more stuff. Yeah, you can find more stuff before the day ends. So anyhow, so the learning outcome 2.1 of unit 5.11, it states strengths and weaknesses of multidisciplinary teams for integrated service delivery. When we were having our first session on this unit 5.11, at that time we looked at we defined multidisciplinary teams, we looked at some of the strengths and some of the points of these MDTs. And at that time, we looked at few of the problems that could be there in establishing and making of MDTs. because there are so many different kind of people, expertise, professionals, they are involved. They are there to construct a team. So when different brains are there, different people with different opinions, different mindsets are there. So there are always problems. There are conflicts. There are conflict of opinions. There is collision of personalities, collision of opinions, collision of mindsets. Sometimes it becomes difficult to reach to a conclusion. Sometimes it becomes difficult to allocate resources. And one other thing is sometimes it becomes difficult to define the proper roles and responsibilities of one person, because the thing is that the people, the experts, the professionals who make up a multidisciplinary team, MDT, they are all professionals. They have their own thinking. They have their own opinions. If the persons in a team, one or two persons, they are not ready to accept each other's viewpoint, to go to work like a team, there are problems. And after the service users, the people who are relying on that MDTs, they suffer at the end. So it is, and in our last session, we stated it very clearly that it is very important that in MDTs, the roles and responsibilities are set clear. And as the learning outcome 2.2 says, it is how to lead a MDT. The leader in multidisciplinary teams where different professionals, different experts are involved. The role of leader is of pivotal importance. It plays a pivotal role in cohesion of a team, in adherence of a team to each other. If is not realizing their potential, they are not realizing their responsibilities, teams they become weak, and ultimately the teams they fail. So there are different kinds of problems, weaknesses that we have looked at in previous session, and we are saying it now. Obviously, strengths are so many strengths of in multidisciplinary team, and there are so many different professionals, they are involved, different experts are involved. So their target, if you look at the positive side, their target is to create a constructive, cost-effective, result-oriented care plan for the service user, for the patient under consideration. So they set appropriate treatment plans for the patient. There are multiple of viewpoints, as we have said. So many different people, they gather together to make MDT, saving staff time, so they work together. So instead of the one person, one patient is being sent, is referred from one professional to the next. They are all in one team. That saves staff time. It improves coordination. There's a continuous professional development for different professionals, and it streamlines the referral process. If we look at the first, if we look at one by one the advantages, the strengths or advantages of multidisciplinary teams, we come across so many different kinds of advantages or plus points. So the multidisciplinary teams, they, as we have already said, they bring together so many different professionals, different experts belonging to different fields of medical, for example, surgeons, radiologists, pathologists, oncologists, palliative care specialists, and other professionals. All these professionals, they are helping to ensure that patients receive appropriate investigations and treatment, and all these professionals, these experts, they are helping to deliver a coordinated care within the hospitals and within the health and social care services. There are so many strengths of multidisciplinary teams, as we have bullet point few of them here. So the most important benefit or strength of MDT working is that each individual patient gets the most appropriate treatment decision made by a team of experts. It is possible to consider each single patient from a range of viewpoints from people with different areas of expertise. This practice ensures that each patient is offered the best possible treatment currently available. Moreover, structured organization of multidisciplinary team meetings is crucial so that different professionals can make their contribution without being present for the whole of the meeting. if this is not necessary, thereby it saves staff time. Then another advantage, another strength is the key requirement in these kind of teams is that discipline is able to contribute independently to the decisions so that individual patients get the most appropriate treatment decisions. Another strength is that the MDTs also improve communication and coordination of communication between professionals and patients and carers and coordination throughout the service. And continuous professional development. It is an effective framework. What is effective framework? Multidisciplinary teamwork is an effective framework for maintaining uniformity of treatment delivery across the country. Auditable standards will lead to improving the service continuously. Moreover, continuing professional development of members of teams and their adherence to public guidelines can be supported and monitored. This another strength of MDT is that it speeds up and streamlines the referral process and thereby reduces undesirable delay in starting treatment. So the main strength above all these ones is that, as we have said, that multiple of viewpoints, different carers, surgeons, radiologists, pathologists, pharmacists, physiotherapists, they all make up our team. They are all gathered on one platform to provide the best treatment possible to the service user. But as any system, any approach is not 100%, it's not perfect, it's not 100%, there are always drawbacks, there are always some weaknesses. So in the same way, there are some weaknesses that are associated with MDTs. So what are those weaknesses? So these weaknesses, few of them are enumerated here, they are listed here: time intensive, high cost. As we have said earlier, few of the things, to construct a team of professionals, it is a quite time intensive. To recruit different professionals from different, so there are so many different disciplines under health and social care, and to create one care pathway, to create one team that works for different kind of disciplines is quite time intensive. You need to select the professionals, GPs, surgeons, radiologists, pharmacists, nurses, affiliated nurses. It is quite time intensive. Then moreover, the cost that is involved, there is a high cost. And one other big disadvantage is, as we have already said, is the conflict. As we have said, when different people with different viewpoints, with different expertise, different mindsets, they are there. So to the conflict, the arise of conflict, or the chances of conflict of the personalities, of the viewpoints, clash of viewpoints, that should be expected, and that is normal. So the disadvantage of MDT is that this is quite time intensive, as we have said, and resources and resource. Proper resourcing of manpower and facilities are required for the professionals to provide the time necessary for regular multidisciplinary meetings. So each patient as we're talking about in care pathways or MDTs, each patient should be typically covering, for example, if we look at the care pathways, each patient in UK is covering a base of 1 year in the UK, and it may not be possible to institute all the recommendations at once. Different recommendations given by different professionals in a team. It is not always possible that all these recommendations, they are instituted, they are met. Therefore, prioritization is going to have to be made, and desirable MDTs functioning can also be achieved gradually over a period of time. If you come the cost, it is estimated that the cost of setting up multidisciplinary teams in health and social care might be more than 2 to 3 million pounds for example, if we take the example of, for example, head and neck surgery. If just we take one discipline under health and social care, it is estimated that to construct MDTs for head and neck surgery, for example, cancer surgery, for example, it costs NHS approximately 2 to 3 million pounds. So these are quite, the establishment of MDTs is quite cost effective, high cost, and time intensive. So another, the cost of provision of services such as the provision of some scans, for example, some other recommendations, and they are also time consuming. They are also cost. They also involve cost. This is very quite obvious. For example, when for you go to, first of all, your first point of referral is your GP. When you go to your GP for anyone one concern, they send you to a specialist, and specialist advises you with few of the blood tests, urine tests, some of the scans, some of the radiographies. You went to have your blood samples, and you go to your the radiologist. You go to have your so ultrasound scans and all these kind of things. Then again you are referred back to your. So all these working of a team, it is quite time intensive, and it involves a high cost. So about conflicts, we have said so many things about the conflicts, the different viewpoints they collide and personalities when they collide. It is normal to have conflicts. So especially when why conflicts happen when people do not leave, or they cannot leave their egos behind. Conflict and resentment arises. People become unwilling to open their minds to other perspectives and are intent on either forcing their point of view or not cooperating with others. Why? Because each one in a team, this is the negative side, disadvantage. Each one in team, they know whatever their viewpoint is, that is perfect. So they are not open to other perspectives. The more conflict, the less innovation, obvious. The farther the team gets from implementation and meeting their goals. More conflicts, less innovation, less the team is far from achieving their goals. When a team has the potential to boost up the individual members, if it is not functioning properly, it can make some members feel inferior and unimportant. In most of the cases, in hierarchy, in a multidisciplinary team, in hierarchy, the lower staff, for example, the carer or some nurses, they feel that they have no say in the process. They feel themselves inferior and unimportant, and that's not good for working of a team. They contribute. What happens? They contribute less and are discouraged from accessing their strong qualities. How much each person is contributing or not contributing becomes the focus of the individual. Some feeling they are carrying in a, it happens, always happens. One person feels, or some feeling they are carrying the team, others resenting those who are taking charge. So what all these conflicts they result in relationships and communication worsen. The team is, what is the result? The team is unsuccessful, and the individuals walk away worse off than they started with. These are many of the disadvantages. So question here arises, okay, we have looked at the strengths, we have looked at the weaknesses. If there are strengths, everything is fine, everything is green, okay, no problem. But if, like, we have looked at different kinds of weaknesses, different kinds of disadvantages or weaknesses of negatives of MDTs, if there are weaknesses, so what you should do as a team member, what can be done if you are a team leader? So we will quickly go through the role of a team manager, team leader who is leading the team, and as a person who is member of a team. For example, if there are all these weaknesses are there in your team, people are not ready to open up their minds, people are not ready to accept other viewpoints, there are conflicts, there are disruptions, there are disputes, there are different kinds. People are feeling inferior. One few people are feeling they are running the team, they are doing everything. If this is a situation, what a team leader can do in that situation. So a team manager, a team leader, this is their responsibility that they should set clear, specific expectations and have a dialogue with their team member so they can understand their expectations. It is important that the team members they not only understand the goals, but they also understand the reason the team has been created. A good team leader, a good manager will allow a team to function without hovering over it, but will be fully involved by eliciting information on a consistent basis rather than waiting for the deadline to evaluate the results. So, as being a manager, team leader, you should communicate with your team, evaluate performance and commitment, and step in to assist when necessary. The team may very well need additional resources or input from their leader or from their manager. This is how, being a manager, you can resolve these weaknesses or you can tackle these weak points or these negatives. But if you are not a manager, you are a team member, what will you do? If you have just been assigned, take the time to listen to others in the group, be involved in the process as there will be a process that sorts of responsibilities and leadership roles. But being a team member, you should open your mind and realize teamwork takes patience, understanding, and mutual respect. And if you are given any role, for example, any volunteer role, understand your role and own it. Make the decision to be a problem solver. Do not look to place blame and do not focus on the negative. Stand up and make things better rather than sitting back and complaining. You will feel good about yourself by helping the team, by making it better for everyone. A negative in a team, in MDTs, a negative attitude of any team member can be contagious, but so can be a positive one. It is often a team victory we rejoice in and remember above all others. The team environment can be very, and a team success doesn't depend on you, the individual. Your commitment to your team, despite obstacles, is vital to the process. So, there are weaknesses, there are strengths of MGTs, and how to tackle all these, uh, how to tackle with all these problems. The role of team leader, the role of team members is very important, but besides that one, the role of team leader is very important in creating, the team is created, but in cohesion of each staff member to each other, in adherence of staff member to each other, to reach to a effective, a productive, a fruitful decision, the role of team leader is very, very important. So we look at the role of team leader that makes your 2.2 LO 2.2. So the skills required to build, motivate, and lead multidisciplinary change. This means what a leader, obviously whenever there is a team, there is a captain. Whenever there is a team, there is a leader. So what a leader can do to make the performance of the team up to the mark, up to the standard, how to resolve these conflicts, how to make the team functioning more better than the previous, how you can make your team or as a leader can make their team working, their today's working that can be improved, that can be made better than yesterday. So we look at different kind of attributes of a team leader they can use to build and motivate the team. So being a team leader or manager, they should provide and justify a clear sense of purpose and contribution. That means a team leader should focus explicitly on the needs and experiences of service users, continuously reinforcing an inspiring vision of the mission and social contribution of the organization in terms of service quality. Team leaders should interpret the wider environment, for example, policy frameworks, systems of accountability, and evidence on effective healthcare. making sense of what is required of the organization and staff, including the need to work in closer collaboration with other organizations or occupations. Then comes a team motivate to work effectively. A team leader or manager should motivate team and so that they can work effectively. To do that, the team leader should define clear and challenging goals with the team and each member of their team. Team leaders should build team commitment and a positive emotional tone or climate, articulating that both staff and service users are valued and attending to staff well-being. A team leader, team manager should encourage high staff involvement and engagement, permitting autonomy within framework of values and goals focused on meeting user needs. Team leaders should provide and operate meaningful design for organizations, subunits, and jobs with underpinning human resources. Yes. Human management systems that provide relevant staff development and reward. Team leader, team manager should manage and improve performance rather than just reporting it, with openness to a variety of perspectives on performance, including soft intelligence, rather than focusing on a narrow range of hierarchical imposed targets or indicators. Team leaders should listen to staff and respond to their voices, validate and engage with difficult or negative emotions evoked by the experience of delivering care, rather than surpassing or denying them. A team leader should focus on improving system performance. To gain this goal, they should enact and encourage the practice of service improvement with compelling cases for change and carefully constructed plans for change based on a variety of kinds of evidence. They should address system problems, pursue innovations, initiate new structures and processes, find ways to intervene informally in patterns of thinking and action. Team leaders should model learning of new behaviors, form accurate assessments of own and unit effectiveness, and identify new ways of working appropriate for new and changing circumstances. Team leaders should do all these coupled with a willingness to show some self-doubt and acknowledge mistakes. What other attributes to motivate a team leader requires? How to motivate a team? What skills a team leader requires? There are some other very important skills that a team leader attributes that a team leader should have with themselves to motivate a team to work more effectively and more fruitfully. For one, we can set clear goals. So goal setting is linked to task performance, and it is the main source of intrinsic motivation. Obviously, when the goals they are linked to the performance, it's the main source of intrinsic motivation. It's motivation driven by an interest in the task. Team members, they develop interest in the task, they become motivated within themselves. Setting specific and clear goals leads to greater output and better team performance. Therefore, being a team leader, set unambiguous, mirror, and clear goals with a deadline for completing to avoid any misunderstandings. Then empower people. Team leaders should empower people. Imply participation places emphasis on communication, openness, and the direct involvement of team members in decision making. Team leaders should provide support and facilitate discussion to help the team solve problems. As confidence, commitment, and competence increases, delegate tasks and let team members take decisions or find solutions to problems. Then team leaders should give the right support to their team members. Change usually implies that the team has to learn new skills on the spot and interpret new ways of working. The team leader must give opportunity for the team and individual to develop and try new approaches, make sure the team has appropriate training, development resources, and time to confirm their new skills. Then communicate the vision. Very important, a team leader must communicate with unambiguous words, unambiguous tone, the vision of the multidisciplinary team. Defining, developing, articulating, and communicating the vision is relatively straightforward. Inspiring others to follow is the real challenge. Yes. To inspire your team, you need a simple, clear, and relevant vision of the way ahead. That's more you need to be credible, trusted, and believable. Show appreciation. A team leader must invest time and energy in their team. Everybody's task performance needs to be appreciated, and it encourages them. And your team is no different. So everybody in the team, they need appreciation. They need to be valued. If there are no rewards, any kind of incentives in a team or any kind of money-related awards, at least being a team member, being a team leader, members, they are praised. They are praised verbally. They are appreciated verbally. They feel valued, they feel encouraged, and they like to put more into their task in the performance. And all these things collectively, they result in creation of a more effective, cohesive, result-oriented, focused, fruitful team for any care pathway, for any discipline under health and social care. So these are a few of the things we have looked at, Faraheen, the weaknesses and strengths of multidisciplinary team. And we looked at being a team leader, how a team leader can motivate, what skills a team leader needs to motivate team, to make them more task-oriented, to make a team fruitful. If I look at the assignment for this one, so this is 15 credits your assignment, and this is it is uploaded on the Moodle. It is there on the learning management system, so you can see there. So this is uploaded there. So your task 1 of the assignment, it covers your 1.2, learning outcome 1.2, and learning outcome 2.2. If you wish and you have time, you can start working on the task 1. So, okay. Can you see my screen?
No.
Hello?
I can't see your screen.
You can't see?
No, I haven't. All this time I couldn't see your screen.
You couldn't see my screen? I shared it.
Oh, I couldn't see you all this time.
I was of the view that you. Oh.
Oh, okay, I can see it now. It's just come up now.
Ah,
I couldn't.
Oh my goodness! I was thinking that you can see all this stuff because I shared the screen, but I don't know somehow it went offline. I was of the view that you can see everything.
No. From the start, I couldn't see anything. Before it disconnected, I couldn't see anything. I can see it now. It's just come on now, but I couldn't see anything before. It's okay.
Anyhow, I will be sending over to you all this. Don't worry about it. And I will send you the recording, and I will be sending the recording, and I will send you the stuff as well.